What a great pleasure it is for me to be here and speaking to such a wonderful crowd. Dr. Hugo has really done a good job of alerting all of you to the power of this new medicine. And really it's not new, it's really just doctors beginning to realize that if we're going to do a good job with our patients, we have to look for the real root causes of why they're ill, not just ameliorate their symptoms. Many patients want their symptoms desperately controlled, and pharmaceuticals will control symptoms, but it's kicking the can down the road and creating the basis for future problems. And so in my 29 years at the Reardon Clinic, I have nothing but a deep sense of gratitude for the opportunity to begin to synthesize what are the basic principles of good health. I'm sure many of you went into the practice of medicine or whatever specialty you're in order to help people. And in our desire to provide help to desperately ill patients, we oftentimes go for the quick fixes. And that, unfortunately, has become the earmark of modern medicine. And what we have now is a worldwide epidemic of chronic illness. Dr. Levy's presentation makes that very clear, that for some reason we, in the general allopathic approach to medical care, seem to be satisfied to deal with superficial causes and not look for the real causes. And so the reason I'm here today, and my presentation will be in two parts. It's one lecture, but it will be in two parts. I do think we need to eat some food, you know, but anyway, I'm gonna hang in here until Hugo tells me to sit down. But it'll be in two parts, and what I'm going to be talking to you about is more on the conceptual order of things. Because I've been doing IV vitamin C now with Dr. Reardon until his death in 2005 and ongoing since that time. Probably have been responsible for over 100,000 IV vitamin Cs, observing the patients before they started, during their treatment, the success cases, even the people who fail, which means they succumb to their illness. Without doubt, vitamin C does provide quality of life and reduction of pain, improved overall sense of well-being, reduced side effects from other therapies. So there's no question that IV vitamin C is a very powerful therapy. The question I ask, and I'm going to explore that question with you today, is how does vitamin C do this? What is it about this simple little molecule that gives it such an important place in our understanding of what maintains and improves our patients' health? And from a selfish perspective, all of you should be interested in this for your own health, because as healthcare providers, you are in the line of fire. Doctors and nurses get sick just as much, if not more, than other patients. And it is in your best interest to take good care of yourself and to want to know what you are doing is working. And one of the best ways for that to happen is to use a little guideline that Dr. Reardon taught me. He said, don't prescribe anything that you haven't been willing to do on yourself. So one of the beautiful things about this emerging new real medicine, biological medicine, nutritional medicine, orthomolecular medicine, whatever term you want to give it, is that it is available to people who are already well and want to stay well, to people who are sick but not seriously sick and want to get well, but it even works for people who are desperately ill and want to fight their way back to better hope for the future. All of these things can be accomplished with this medicine with very low side effect profile and very large patient sense of well-being and compliance. Though the big problem that I run into is patients want results right away, and many times it's slower than that. IV vitamin C can give immediate results, and that's why at our clinic we have the motto IVC first. And if the patient comes in and you're not sure what to do, obviously check some basic lab, check renal function, check the G6PD, assess their cardiovascular status, but if at all possible, use IV vitamin C first. We have had very good success with the IVC push, which is a 7.5 gram, calculated osmolar push that maybe tomorrow I can show you a video on the IVC push. It's a really good way to get patients started on the right foot. Well, let's get into today's lecture. So, I've entitled this A Tale of Two Medicines because it really is a story, and it's my story of trying to figure out what does vitamin C do? How does it work? How do we look for the root causes? What are they fundamentally related to? How can we use this understanding then to help our patients begin to make steps in the right direction? And you've gotten a good taste of that in listening to Dr. Levy's presentation on oxidative stress. Actually, towards the end of this presentation, which won't finish until later on this afternoon, I have developed a unified theory of chronic illness that I think will be of some help to you. But ultimately, it's you sitting in front of another human being who is asking for your help, wanting you to give them some guidance that's going to lead them to a better way of life and to reduce their symptoms, but to reduce their symptoms on the basis of correcting the real causes rather than just covering up the symptoms. I worked for many years in my father's gas station, and I oftentimes use the analogy of someone coming in with the oil light on. And what if the mechanic said, here, take this piece of black tape, cover up the oil light, you'll feel better, and then you can call me when the engine quits. That's not the way to practice medicine. So what we're doing now is looking at how vitamin C and oxygen play fundamental roles in this. And this is a kind of detective story in its own right. And I'm going to be covering a lot of territory in trying to put this together for you, but I hope it is helpful to you. So as Dr. Levy has rightly pointed out, life is electron flow. It's just amazing to think about something that none of us have ever seen, but we utilize electron flow in every facet of our lives. And it's the correct flow of electrons through our organelles, our cell membranes, our bodies, our nerves, our brains, our cell phones, our cars. Everything depends upon the management and balance of electron flow. Erwin Stone, who was a pioneer in understanding the fundamentals of vitamin C, ascorbic acid, he said the molecular basis, the whole living process, is nothing more than an orderly flow and transfer of electrons. And of course, Linus Pauling certainly he was Dr. Reardon's hero. And when Linus Pauling died, Dr. Reardon picked up the flag to continue the search onto how vitamin C could be of help to cancer patients. But really,